Alright, next we're going to continue our look at the autonomic nervous system. So we're looking at the autonomic nervous system, which is made up of the parasympathetic and the sympathetic nervous systems. Keep in mind that all preganglionic fibers of the autonomic nervous system are cholinergic or release acetylcholine, whereas parasympathetic postganglionic fibers are also cholinergic or release acetylcholine. But then when it comes to the sympathetic postganglionic fibers, they release norepinephrine. And whether or not norepinephrine or acetylcholine binds to certain receptors decides on whether or not that signal arriving at the effector is stimulatory or inhibitory. We can also look at cholinergic receptors. These are receptors, like cholinergic fibers, that have to deal with acetylcholine. So if cholinergic fibers secrete acetylcholine, cholinergic receptors bind acetylcholine. There's actually two types, nicotinic and muscarinic, and they're named after drugs that bound to them during the time in which they were studied. So first let's take a look at nicotinic receptors. They're found at the neuromuscular junction. They're on motor end plates. Almost all postganglionic neurons of both the sympathetic and parasympathetic division. So they tend to be kind of on that cell body dendrite area of the secondary neuron for the sympathetic and the parasympathetic divisions. They're also found on the hormone-producing cells of the adrenal medulla, which is that one scenario I haven't really pointed out in the image we've been using. The effect of acetylcholine when it binds to a nicotinic receptor, which is also a cholinergic receptor, is always stimulatory, which makes sense because when acetylcholine binds to the nicotinic receptor at the neuromuscular junction, we get stimulation or skeletal muscle contraction. Alright, note here where the stars are. At skeletal muscle, at the postganglionic cell body for the sympathetic nervous system, at the adrenal medulla for the sympathetic nervous system, and at the postganglionic body for the parasympathetic nervous system. Alright, next we're going to look at the muscarinic cholinergic receptors. So they are oftentimes going to be on effector cells that are stimulated by postganglionic cholinergic fibers. Depending on what acetylcholine is binding to, the result can be either inhibitory or excitatory. It's not one or the other always. So it depends on a receptor type. For example, when we have adrenergic receptors, we're looking at receptors that bind norepinephrine. And adrenergic receptors have receptor types, alpha and beta. And the effect of norepinephrine binding to alpha receptors is usually excitatory. And the effect of norepinephrine binding to beta receptors is usually inhibitory. I have to say usually and not always because there is a notable exception. When norepinephrine binds to beta receptors, again those are usually inhibitory, but if it's beta receptors of the heart, then that norepinephrine on those beta receptors for the heart is stimulatory. So let's look here where we have hearts and lightning bolts. Those are showing where the adrenergic receptors and muscarinic receptors are found respectively. Again, adrenergic receptors are stimulated by norepinephrine, and muscarinic receptors are stimulated by acetylcholine. Alright, next we're going to talk about the interactions of the autonomic divisions. So when you're looking at the visceral organs of the body, you're looking at organs that have nerves going to them, meaning that they're innervated, and they happen to be innervated by both the sympathetic and the parasympathetic nervous system. So there are neuron fibers from both divisions going to our abdominal viscera or our abdominal organs. What this results in is what's called a dynamic antagonism. So kind of this back and forth control between sympathetic fibers and parasympathetic fibers. For example, sympathetic fibers increase heart rate and respiratory rate, and they'll inhibit digestion and elimination. And parasympathetic does the opposite. It decreases heart rate and respiratory rate, and it allows for kind of an increase in digestion and the discarding of waste. So we're looking at the sympathetic really as essentially your uptick or your gas pedal for the body. It's going to be able to, even on its own, control things like blood pressure by keeping blood vessels in a continual state of partial constriction. That's called sympathetic tone, or vasomotor tone, because it's responsible for regulating that dilation, or not dilation, of blood vessels to regulate blood pressure. Now, the sympathetic tone is not something that's generally undone by the parasympathetic nervous system, so it does have some jobs all on its own. For example, sympathetic fibers tend to fire more rapidly to constrict blood vessels, and that would cause blood pressure to rise. And then sympathetic fibers fire less rapidly to prompt vessels to dilate, and that would decrease blood pressure. You can actually use alpha blocker drugs to interfere with the vasomotor fibers, and that's used to treat high blood pressure called hypertension. Just like there's sympathetic tone, or roles of the sympathetic nervous system that it does all on its own, the parasympathetic system has the same thing. There is parasympathetic tone, which is actually used to slow down the heart. It also dictates normal activity levels of the digestive and urinary systems. Now, the sympathetic division can override these effects during times of stress, so fight or flight, and drugs that would block the parasympathetic responses to increase heart rate and block fecal and urinary elimination generally lead to retention. Now, again, sometimes we have that antagonism and other times we don't. There are far more sympathetic division roles that the sympathetic nervous system handles all on its own than what we see for the parasympathetic. So, kind of unique sympathetic division roles include thermoregulatory responses to heat, the release of renin from the kidneys, and some metabolic effects. So this tends to include activity of the adrenal medulla, sweat glands, kidneys, and most blood vessels. So when it comes to the thermoregulatory responses to heat, this is where we see applying heat to the skin causes a reflexive dilation of blood vessels. These are dermal blood vessels. So that's going to result in widespread dilation, and that tends to result in sweat glands starting to produce sweat that helps cool the body. Because it's a rise in systemic body temperature that's resulting in this widespread dilation of blood vessels that's allowing heat to escape from the body or bringing heat to this area where the sweat glands are, and that's why they secrete sweat to help cool the body. And then when temperature falls, those same blood vessels in the dermis constrict, and the blood with all that heat stays in the deeper vital organs, so it doesn't cause the sweat glands to produce sweat. There's also release of renin from the kidneys, which requires sympathetic impulses to activate the kidneys to make them release a chemical called renin. Renin is actually an enzyme, and it causes the formation of a blood pressure increasing hormone called aldosterone. There's a lot more on that if you want to look it up and learn more about that before you get into higher courses. You can look up the renin-angiotensin-aldosterone system. And then the metabolic effects include increasing the metabolic rate of body cells, raising blood glucose levels, mobilizing fat for a food source, and stimulating the reticular activating system of the brain, so that increases mental alertness. Again, these metabolic effects are part of the sympathetic division unique properties, so they're not reversed by the parasympathetic division. And when we're controlling the autonomic nervous system, the boss is definitely the hypothalamus. But the hypothalamus does communicate to higher orders, like the cerebral cortex, reticular formation, and spinal cord. Now, when it comes to hypothalamic control, it's not just the autonomic nervous system that it controls. It also controls the endocrine system, and it's the body's emotion center, thirst center, hunger center. So things like heart activity and blood pressure and body temperature and water balance and endocrine activity, emotional stages, and also control of the autonomic nervous system, so responses or reactions to fear with the fight or flight system. All of that is under hypothalamic control. You can see here the hypothalamus just below the thalamus and how it's linked to higher order limbic system and cerebral cortex areas. Also, it's going to be linked to the brainstem, where the reticular formation can be found that helps regulate pupil size, heart, and blood pressure and airflow, even salivation. And also the spinal cord, which has reflexes for urination and defecation, even erection and ejaculation. Now, to finish up, we're just going to take a look at a couple of disorders related to the autonomic nervous system. Hypertension is high blood pressure, and it's a result of overactive sympathetic vasoconstrictor responses to stress. We would treat this with an adrenergic receptor blocking drug. Then there's Raynaud's disease. That's an exaggerated vasoconstriction in the fingers and toes. It's treated with vasodilators, but it can result in pale or kind of blue colored fingertips, and it can be quite painful because of this vast and quick vasoconstriction in the extremities. Then there's autonomic dysreflexia. So this is a syndrome where your blood pressure skyrockets or increases very quickly. It's going to be caused by uncontrolled activation of autonomic neurons. Now we see this more in quadriplegics and those with any spinal cord injury above T6 or the 6th thoracic vertebra. It can be life-threatening because it's an imbalanced reflex sympathetic discharge, and it can result in uncontrolled hypertension or very severe high blood pressure, which can lead to seizures, retinal hemorrhage, pulmonary edema, renal insufficiency, myocardial infarction like a heart attack, or a cerebral hemorrhage, and even death. So it is something definitely very serious, but it is more common in those who've had issues with their actual spinal cord. Alright, and that is it for Chapter 14. It's quite short. It's a close look at the autonomic nervous system. So make sure you watch both parts, the one before and this video.